Hi, everyone. I wanted to talk to you about being your own patient advocate and having someone there to advocate for you if you go to the hospital or get medical treatment. I'm a retired RN of 29 years. Worked both civilian and military. Well, let me add VA in there also. Worked in private hospitals and also in a university hospital. And I've worked in various areas. I spent a lot of time on med-surg floor, med-surg tele, which is a place you would go if you had injury or post-operative or have medical problems or heart problems. Anyway, I got a list here of stuff to talk about, and the reason is that our family's had some encounters in the hospital, and thank goodness I've got medical experience. So if you're having some serious medical treatment, or you're going to the hospital, you're going to stay in the hospital, have surgery, I really recommend that you have a nurse friend or a physician friend to bounce questions off or to be present, because people in the hospital, a lot of people in the hospital take shortcuts because the hospital puts pressure on them. So very frequently you're short-staffed, and the emphasis is on you getting your charting done, get your medications out, do the wound care, and get out on time. If you're not out on time, it's held against you. You're looked at as being slow. And now that I'm retired, I'm seeing why I was one of the last ones to get out every shift, because I made sure that people had the ice water filled up, urinals emptied, commodes emptied, diapers changed. Tried my best to feed them when they couldn't feed themselves. And there were other nurses that were looked at well, and they just didn't pay attention to those things. They'd leave their shift and there'd be a urinal sitting there on their bedside table, not empty. Or they leave someone who really can't feed themselves to fend for themselves. Not good. So, let's see, I got a little list here. So, mother-in-law fractured her hip. She was taken by ambulance to a hospital in Augusta, spent 7 hours with my wife in the emergency room, had labs drawn, and that was it. She never got diagnosed. They were behind. So 7 hours, and finally she left. They went to an urgent care place. They didn't diagnose her properly, and finally she went to a local hospital, and they determined that she had a fractured right hip. So anyways, was a couple of days in before she ended up getting diagnosed, and then she went to surgery. So she gets out of surgery, and I noticed when I went in that the nurses were always sitting behind the computer doing their charting. Well, there was an order that mother-in-law was to get up and walk. So at first they would get her out of bed, and ordinarily that'd be, first time up would be physical therapy, would get the post-operative patient up, and really every day they ought to be the ones coming to get them in. But really after a bit, the nurses need to be getting that patient out of bed. Mother-in-law is physically handicapped, but she's not overweight. The nurses would not get her out of bed. My wife said something to the doctor said something to the nurses, still didn't get her out of bed. So the whole time she was there, she never got out of bed. And I'd go in there and I'd find her slid down in the bed, and I'd have to pull her up because no one else did it. One time she didn't have the abductor pillow between her legs. You're not allowed to cross your legs, you could pop the hip out. That wasn't there. I mean, these are big no-nos. And so I turned that into Joint Commission. I don't know if anything got done with it. Then I want to bring up about my wife. One morning she woke up, I remember it was a Mother's Day, and she was having bad pain in her lung area. Took her to the emergency room. They had young residents there, and I had I had remembered that I took care of a general one time that had been on a long flight uh, back from Iraq, I think it was, and he ended up getting a PE, pulmonary embolus. Those could really be life-threatening. And my wife had taken a much shorter flight within a couple of days of having this happen. And so I said, they weren't finding anything wrong with her except her blood pressure was high and she was having chest pain. And they ran labs on her and it wasn't a heart attack. And I said, really need to see if this is a PE, pulmonary embolus. They didn't do anything. I mean, we're talking residents in their 20s, don't have a whole lot of experience. I brought it up again at least once. And finally, one of the other doctors checked her out, and sure enough, she had a pulmonary embolus. And she ended up getting it. Yeah, they were going to send her home. My wife said, no way, I'm staying in the hospital. So she was anticoagulated in the hospital, I guess, 2-3 days, and she was allowed to go home. If I wasn't there, she wouldn't have been diagnosed properly. They think, oh, he's just a nurse. Well, you know what? I've seen a whole lot of stuff in my days. Then I went to the hospital. I had pretty major sinus surgery done. I mean, it was 4.5 hours in the operating room. And pre-op, things went fine. Now, I've run 2 same-day surgery units, and I've also worked PACU some. So that's post-anesthesia care unit. And after surgery, when I started waking up, I had terrible shoulder pain, and I could only lift my left arm about 2-3 inches, and that was it. But they were in a big hurry to get me out of there. So here I was in intense pain. I told them I was in pain. I got nothing for it. They're supposed to treat your pain. They could have called the doctor or spoke to the doctor and given me something for pain, but they didn't. And the other thing is, I couldn't lift that arm. They should have checked me out for a stroke, which happens to people during surgery, but they didn't do it. Thank the Lord I didn't have a stroke. So then I get to the same-day surgery unit. Come to find out I'm the last patient for this nurse to get out the door. I was kept a minimum amount of time. So I've been in surgery 4.5 hours, which is a really long sinus surgery. And she's pushing me to get out the door. And I felt so weak. I felt like a 6-year-old could beat me up. And I could barely get into the wheelchair. But out the door I went. So I said something to the surgeon last week on my follow-up appointment. He said, you're the second person to tell me they felt rushed out the door. He said, I'm going to file a formal complaint. Well, I wrote to the chief nurse, and the same hospital took care of her mother-in-law. Sat there 7 hours in the emergency room, the place where I had surgery. And so I wrote to the chief nurse there, and it's been a couple of weeks now since I mailed the letter. And this is an issue of poor leadership. I mean, it really does come down to the leaders. So what's he do? Well, whoever got that letter, whether it was him or it was his secretary, if he has one, punted it to a patient advocate. You know what? I don't want to, I'm sorry, I hope things are going to be better. The patient advocate wants me to call back. That chief nurse should have answered me, but he's not doing it. Let's see if there was anything else here. Okay, specialist. So, say you're going to your primary care doctor and you're having a problem with something. Well, for instance, I'm almost for certain I've got a partial right rotator cuff tear. I had to ask for an MRI. I had to ask for a referral to a specialist. A lot of time you've got to ask for stuff. If you've got bad allergies, you're going to your primary care. They may try taking care of it themselves. Or you've got asthma, they may try taking care of it themselves. And sometimes that's okay. But they can always tell you no. So ask for a specialty referral if you think you need one. And if you aren't sure, ask a friend that knows how things work, how things ought to work, like a nurse friend or a doctor. Find out whether you need to get that kind of referral. You may also have to ask for medications. You need to ask for refills. I feel sorry for elderly people who can't remember stuff very well. For instance, like going to the hospital. This is a big hospital complex. The instruction for parking report, we went around the block 3 times to try to figure out how to get to the patient parking. Finally figured it out. So you need help, folks. The other thing about specialists is that I noticed when I worked the floor, and I'll tell you, I still have nightmares to this day working the floor because it was so hard, so intense. It could be pretty brutal. You feel like a truck ran over you. But anyway, the specialist would come in. You know, I had to act like a lot of things. I had to act, called myself a potty tech. I had to do the meds. I had to deal with pharmacy. I had to deal with the doctors, the family, social work, all kinds of, physical therapy and radiology and lab and all this other stuff. So specialists most of them only care about their, if they're a pulmonary doctor, they only care about pulmonary. If they're a urology doctor, they only care about urology. If you tell them, they come in and you tell them, hey, this patient or my loved one's blood pressure is really high and it's a urology doctor, you ain't going to care. You need to talk to the right person and make sure you follow up. If somebody doesn't follow through, say you told your nurse when you were in the hospital that you needed something or you needed to get up, it isn't happening, the squeaky wheel gets the grease. Now, my brother's wife died of cancer. She went to chemotherapy for years, and my brother says the same thing. You got to be your own advocate. So that's what I want to encourage you to do.